Assalamu alaikum. Today our topic is inflammation, and in which we will discuss about all the inflammatory events which occur during injury and during inflammation process. So, what is inflammation? Inflammation is a vascular and connective tissue response to injury. Injured by any means will have inflammation. Purpose of inflammation is to bring more blood, more defensive cells, more neutrophils, remove cause of inflammation of injury, and bring cells for repair. In simple words, inflammation is for focus of body on injury site. So types. There are two types: acute and chronic. In acute, there is a rapid developing response, and short-lived. And in chronic, there is a response lasts for a very long time. Any type of injury to tissue which is vascular will result in inflammation. And there are some signs of injury. These signs are pain, which is dolor, rubor, tumor, color, and functionality, in which pain, redness, swelling, hot, and loss of function. What is the mechanism of inflammation? Mechanism. A tissue have arteries, microcirculation, and veins for blood supply. It also have parenchyma cells, which are the function cell like nephron and hepatocytes, and some stromal cells, which are the supporting cells, and for example, macrophages, mast cells, lymphocyte. Any injury to tissue will also damage these cells. When mast cells injured, they release prostaglandins, preformed histamines, leukotrienes, other macrophages. Lymphocyte due to release cytokines, they will start also release the platelet activate factors. They will mediate inflammation. This is called chemical mediators of inflammation. Mast cells present in all connective tissues but more concentrated around blood vessels, nerves, and internal and external lining of the skin. So mast cells are also not present in the central nervous system because inflammation in central nervous system is due to some infection or deficiency, our central nervous system will be damaged. So mast cells not present in brain. Acute inflammation. Acute inflammation further divided into different events like vascular changes and cellular events. Vascular changes are artery dilation and increased permeability of veins. And second is cellular events. We will discuss both. First of all, from this we will first learn what is exudation and transudate. Exudation is a protein-rich fluid which leak out from the blood vessels into interstitium and have a gravity around 1020 because of protein. And transudate, protein poor fluid, less protein in the fluid is transudate. So there are some mediators or chemoreductive factors like histamine, prostaglandin, nitric oxide, which are released from the endothelium cell during injury and causes vasodilation of the blood vessels. Vasodilation of blood vessels accumulate more and more blood in the injured site, and then this further causes the injury. There's again another factor release which causes the contraction of the endothelial cells, and the endothelial gaps will increase. This gap will lead to the leak out proteins from the vessels into the interstitial fluid. When there is protein leak out, this causes the decrease in collateral osmotic pressure and hydrostatic pressure increase. Hydrostatic pressure increase, it means that net force move fluid leaks out. So more and more water also follow the same, and they also leak out from the vessels and causes accumulation of fluid in the interstitium. And we know that in the interstitium there are different mast cells like and which release some factor which causes the contraction of endothelial cells. So what cause increased permeability of microcirculation? How permeability of microcirculation increase? First, histamines, which are released from mast cells. Bradykinin, which are released from plasma proteins at inflammation site. And leukotrienes from the injured cells. These all histamine, bradykinin, leukotrienes, these all led to the increased permeability of microcirculation due to contraction of endothelial gaps. When endothelial cells undergo stimulation of their mediators, they will undergo contraction. They will undergo contraction. So here we will discuss about the contraction, retraction. Normal cells look like this, and all the cell arranged together with tight junctions or with other junctions. But while there is a contraction of the endothelial cells, the gaps between two endothelial cells will increase. For example, like this, these are endothelial cells. When they like this, when the endothelium contract, there is squeeze and the gaps between the cells increase. And so from these gaps, the fluid will leak out. When which cause intraendothelial gaps increase microcirculation permeability. Both contraction and retraction cause increased gaps. So they immediately release so cause contraction first, but cytokines are protein synthesis process, so will occur come later. Every cell membrane have enzyme which is phospholipase 2. When cell will injure, it will break down arachidonic acid into the prostaglandin 2, which prostaglandin 2 immediately. This prostaglandin 2 will cause the dilation of blood vessel B2. Next, this permeability is for short term. They produce but have short life. So they will auto decay after some time and reverse the permeability. Later phase permeability maintained by the cytokines, which is cause retraction. This will remain for a long time. Delayed plus prolonged. This more permeability more seen in vascular side in veins, venules as compared to the arterial veins. Less permeability because venules have more receptor for inflammatory mediators. So in the veins there is more endothelial gaps. Next, this is most common immediately mechanism of increased permeability at inflammatory or injured site. Physiological disruption of arteries and venules causes immediately and prolonged permeability of veins. Uh, there we will discuss about that how these different factors will keep the permeability for longer time or for shorter time. So first a diagram in which more seen in veins. This is about veins. Veins in which there is this line show that there is immediately permeability increase, immediately gaps between the endothelial cells increase, but very short time. After this, there will be decay, auto decay, and this immediately and transient, which is caused due to histamine and the bradykinins. In the diagram, in the to figure 2, we see that this probability increase after a very long time, prolonged, and remain for a long time, and delay. For example, delay and prolong due to cytokines. So first endothelial gaps maintained by the histamine and bradykinin. After these cytokines come and they will maintain this endothelial gaps. After the both venules arterioles immediately and prolonged gap. Immediately and prolonged gap due to some physiological disruption of the veins, which causes immediately gaps in endothelial cell to contract and increase permeability immediately and for remain for a long time. We see that physiological disruption of arteries and veins causes immediately and prolonged permeability of veins. So with the passage, compare the time with the different factors. Another mechanism for WBC leaks into inflammation is transcytosis. Transcytosis is a process in which the WBC packed inside the vesicles and pushed toward the injured site. So in this way, this process is called transcytosis. So WBC reached to the injured site by this mechanism. Next is cellular events. How cellular events take place. In which we discussed that this is WBC, and this is we know that during the vascular events, the permeability and the endothelial gaps increases. So WBC easily reach to this injured site or due to the interstitial spaces. So in this we will discuss in cellular event that how this cellular event take place while pushing the WBC into interstitial cells. All the discussion is about this. For example, we see that there is a bacteria and there is an injured site, so our WBC have to come here and engulf these bacteria and destroy these bacteria. So how will this cause? At inflammation site, when exudation protein rich fluid come out of the vessels, the remaining blood remains more hemoconcentrated and become more viscous, and viscous blood moves slowly at inflammation. We know that at the inflammation site there is more blood flow due to vasodilation. So more blood flow, it means more WBC have chance to leak out into the interstitial. The second is when there is a protein fluid leak into the interstitial, remaining cells is become viscous because of loss of protein and fluid. And they are more concentrated of the from the more concentrated hemo. There is more blood cells in this and less fluid, so it become more viscous. When it become more viscous, its speed velocity will be slow, so it flows slowly over the injured site. Second, short review up to now. We will review all of this what we have discussed now. First of all, severe injury occur, blood flow increase by vasodilation, increased permeability. Now protein rich fluid move protein rich fluid into the site. Blood move more viscous due to the hemodynamic changes, RBC clumps, and WBC into the inflammation site. Push WBC into the inflammation site. This is margination. For example, when there is a less fluid, RBC there is less fluid, RBC become more, they clump together, and we know that there is a laminar fluid in the there is less fluid, this laminar flow will disrupted, and RBCs in the beginning WBC inside the RBC cell. But during margination is a process in which these RBCs push the WBC toward the sides of the blood vessel. So WBC easily leak out from the blood vessel into the interstitial side. So this process is called margination. Chemical mediators produced by cells like histamine, thrombin, leukotrienes, prostaglandins act on the endothelial cells which have receptors. Endothelial cells release granules which have sticky substances. which they plant on the cell surface. This is called Weber pellet bodies present in endothelial cells and platelets. After expression of they become sticky. So in this we will discuss that in the endothelial cell there are some specific receptors which are stimulated and they release some sticky molecules. These sticky molecules is Weber pellet bodies. This is important. Weber pellet bodies. These Weber pellet bodies stick the WBC to the injured site. So these are the endothelial cells, and they release some sticky molecules called adhesion molecules. These adhesion molecules attract the WBC by different factors. Because WBC also express the same adhesion molecule. These adhesion molecules hang together these endothelial cells, and these endothelial cells will push these cells into interstitial space. This is how WBC push into the interstitial space. Neutrophils have special type of extensions on the tip of their special sticky molecules. This is called oligosylated sugars or oligosylated sugars. Oligosaccharide sugars. This is selectins, glycoproteins, expressed on the endothelium under the stimulation of histamine and other molecules. WBC, which are present in the center of the blood stream, can, due to margination, move to the periphery. WBC center present in the center, but at the inner side, due to margination, the RBC push the WBC to the side, so easily escape from these vessels and stick to endothelial cells. And inflammation side, this will hang with the endothelial cells. WBC rolling over the endothelial cells. I think you are understanding how this RBC and WBC stick to endothelial cells, because WBC roll over the endothelial cells and become sticking. This is called rolling. After this, they will hang on some endothelial cells. After this, more cytokines, chemokines, like chemokines, interleukin 8, endothelial cells have receptor for chemokines expressed by macrophages. Integrins are the integrins on the WBC bind with the chemokines stimulated and active integrin. So integrins are a special molecule on the WBC, selectin, glycosylated saccharides. So these are in the binding with the endothelial cells. These adhesion molecule named as ICAM and VCAM. ICAM is a intercellular adhesion molecule and VCAM is vascular cell adhesion molecules. So chemoendothelial cells express ICAM and VCAM, causes stick on WBC on the endothelial cells. Now WBC reside on the endothelial cells. Now next step is to shift into interstitial. So our half work is done that WBC is bind to the endothelial cells. Next we push the WBC into the interstitial cells. Review: severe injury, production of inflammatory mediators, dilation of adhesion arterioles, more blood flow, increased permeability of microcirculation, hemodynamic concentration, stasis, laminar blood flow disrupted, RBC column, hit RBC to margination of RBC, WBC selectin and glycosylated cause stick of RBC rolling over the endothelial cells. WBC rolls over endothelials. The process of margination of WBC into interstitial is immigration or extravascular or diapedoccles. During this, similar molecule expressed on the some both endothelial cells and white blood cells. This is hemophilic attitude. This molecule forces the WBC to push in through the gap. For example, this hemophilic attitude molecule is PCAM. PCAM is platelet cell adhesion molecule. These platelet cell adhesion molecules push the WBC. For example, this WBC bind with the endothelial cells. Then another molecule PCAM will push the WBC into from the endothelial gap into the interstitial, which is squeezed out of the vessels. So next, who will direction of RBC? For example, how WBC directed at the site of injury. Chemical mediators is high. Chemotaxis of the WBC movement. Some chemicals are of bacteria like enfamyl and methicillin amino acids. By bacteria is called neutrophils. By bacteria is to attract neutrophils. Leukotrienes B4 by the endothelial cells. They will receptor on the they have receptor on all over the cells. If mediate from one side, they will move that side. For example, in this they said that some bacteria or some chemotactic factors release some signals molecules to WBCs, to neutrophils. These chemotactic factor bind with the neutrophils, and this neutrophil start moving toward this injured site. So in this we will discuss how WBC move really, because they don't have it. If they don't have the how they move by chemotaxis movement. For example, in this we will study how chemotaxis movement. For example, one leukotrienes or chemotactic factors or some signal molecule bind to neutrophils. In the neutrophils, there is some receptor, serpentine receptor. Receptor GQ protein. GQ protein stimulated, which is a stimulator of phospholipase. Phosphol has stimulated phosphatidyl inositol diphosphate, which causes AP3 and DSC. DSC and the causes the endoplasmic reticulum to release calcium. Calcium bind with this calmodulin and with protein kinase C and phosphorus certain protein. These proteins are actin protein. We have known that actin actin protein help in movement of these cells. So through these proteins, cells start moving toward the injured site, where chemotactin bind with the action chain formed at that site, and actin actin chain grow and push the cell membrane forward. So in this way, chemotactic factors stimulate different special proteins. These proteins actin and these maintain the cytoskeleton of the cells. So where these proteins will move, cell will move toward this same side. Last is there is a LED2 leukocyte adhesion deficiency. There is a disease, and then in this disease, if someone has a deficiency of these adhesion molecules, maybe some person take some immune suppressant drugs or some drug due to some congenital or some due to disorders, this adhesion molecule cannot express on the endothelial cells, which causes so our WBC cannot stick to these endothelial cells. So WBC do not stick, so WBC cannot move to the inflammation side. So it is very difficult for WBC to move to inflammation side without sticking. If we look at the blood sample of this patient, we see that there is a lot of neutrophilia, because the reason is that because neutrophils cannot move to the interstitial space, so they remain in the blood for a longer time. So we see neutrophilia in this patient. So our today topic is complete. All the inflammatory events, we will discuss all the inflammatory events in the cell. So at the end, I will want to we just review about this. For example, there is a severe injury, production of inflammatory mediators, dilation of blood vessels, increased permeability gaps, more blood flow, hemoconcentration, stasis, led to laminar blood flow disrupted, RBC clumps, and push the WBC toward the margin side. WBC margin side stick to the endothelial cells, and the endothelial cells, it bind with the endothelial cell by special sticking molecules, and then move to the interstitial space and start engulfing bacteria or say the injury molecules. So in this way, this all process is called inflammation. During this process, we will see some symptoms like pain, redness, loss of functions, hot, swelling. In the Latin we said dolor, rubor, tumor, color. So these are the symptoms we see during the inflammation.